તો આજે આપણો સબ્જેક્ટ now we are starting our next topic, which is antibacterial drugs. Okay, so antibacterial drugs is classified in 7 classification. Okay, so to remember it more easily, first is inhibits. Okay, so first class 3 classification that inhibit. The next 2 classification as causes. Okay, that cause something, and the last two classification is interfering. Okay, so they which is interfering with bacteria. So let's talk about what is inhibit. So first of all, cell inhibitor. Okay, cell wall synthesis inhibitors. So it inhibit cell wall synthesis. Okay, so the synthesis of cell wall that inhibited. The main drug contain these classes: penicillin and cephalosporin. The next second classification is also inhibits. Okay, what is inhibit? Protein synthesis. So synthesis protein, it inhibits protein synthesis that contain 2 drugs. Okay, tricycline and chloramphenicol. The third class is inhibit DNA gyrase. Okay, so DNA gyrase inhibit. What is a gyrase? So gyrase is a things like, it is like DNA. Okay, this is a DNA, and the lining of the DNA is called gyrase. So it inhibit this. So they contain mainly of one drug with ciproflox. So we covered the first 3 class. Okay, that inhibits. First is cell wall synthesis, inhibit cell wall synthesis. The second inhibit protein synthesis, and the third inhibit DNA gyrase. The fourth class is cause. Okay, that is cause cell membrane leakage. So the bacteria which have a cell membrane, this drug is leakage the cell membrane. Okay, so this, whenever we give polymyxin, that cause cell membrane leakage. Also the colistin, also when we give a colistin, that cause cell membrane leakage. The fifth class is causes mRNA misreading. So what is cause? Misreading mRNA. Okay, so it drugs aminoglycosides. Okay, aminoglycosides. So there are 2 drugs which is contained in the 5th class: streptomycin and gentamicin. So always we give the streptomycin and gentamicin. That misreading mRNA causes misreading mRNA, misreading to antibacterial. Now coming to the 6th class, which is interfering. Okay, so that interfere with DNA function. So rifamycin is okay, we give in TB. Okay, and I give in TB. So the rifamycin, whenever we give rifamycin, it interfering with DNA function, like we give in a TB. So it go in a body, then bind with DNA and interfering with that function. The 7th and the last classification of antibacterial drug, it is interfere with metabolism. Okay, So sulfonamide and sulfones, there are two medication. Okay, whenever we give this medication that interfering with metabolism, and the importance of critical thinking. So whenever we give a critical thinking, or we engaging, or we something in a argument, so we give a questions. So best response to any argument is questioning. There are some list out that way you can learn in your free time. So first this, the dual the dual split experiment. The second is physics and rule. Okay, the third is etc by bit hacker. That is the hacker which hack ETH cryptocurrency. Okay, and the manipulation technique, you can learn any manipulation technique. There are web page which we called red mpmd, that is a github. Okay, so get GitHub and all this stuff. There are a chess, so you can play a chess, and okay, you can play a chess. Then trading is the most important thing you can learn about it. Okay, that is a diva which is a common in microbiology. So what is the diva? Diva is something we know or not know. The dual slit experiment, we also talk about it. Millionaires. Okay, the third thing is real shell or something. When you crack the code, you don't unseen it, and the 1% better every day. Okay, consumer, that is consumes, and creator become creates.